Well, thank you all for joining us for this webcast, which is brought to you by the Knowledge Translation for Employment Research Center, or the KTER Center. We're housed at the American Institutes for Research, and I'm your host, Ann Outlaw. I'd like to go over some logistics for our listeners. You can find information including the presentation slides and the text description of these slides on our website at kter.org. Closed captioning is available by selecting the CC button on the bottom of the YouTube window. And this is an on-demand webcast, so if you have any questions for our presenter today, you can email me at outlaw@air.org, and we'll convey your message to our guest. You can also ask your questions in the evaluation form, which I'll provide at the end of today's webcast. Today we'll hear about a project, a multidisciplinary approach to translating new knowledge into practice to promote health and well-being after spinal cord injury, which is funded by the National Institute for Disability, Independent Living, and Rehabilitation Research, or NIDILRR. This project is one of a handful of projects funded by NIDILRR for translating disability and rehabilitation research into practice. These are exciting projects, as they practice knowledge translation strategies in very tangible ways. Joining us today is James Krause to tell us about his project. Dr. Krause holds the rank of professor and serves as the Associate Dean for Research in the College of Health Professions at the Medical University of South Carolina, or MUSC. He is the director of the Center for Rehabilitation Research and Neurological Conditions and scientific director of the South Carolina Spinal Cord Injury Research Fund, which provides funding for basic, applied, and interdisciplinary studies of spinal cord injury, or SCI. After receiving his bachelor's degree from the University of Minnesota in 1980, he went on to obtain his PhD in psychology, also from the University of Minnesota. Dr. Krause has served as first author on over 115 articles in peer-reviewed journals and has made over 265 presentations at national and international professional conferences. He has published extensively on SCI, including the areas of employment, vocational interests, quality of life, health and secondary conditions, and risk for early mortality. Dr. Krause, thank you so much for taking time to speak to us today. Would you give us some background about your project?
I will do that. Thank you all for listening and joining us. So I am Jim Krause. I do have a spinal cord injury of 47 years, and that was my motivation for coming into the field. And so I have a wonderful team of people working with me, including Melinda Jarnicki, who is helping today as we go through the presentation. And the topic is a multidisciplinary approach to translating new knowledge into practice and to promote health and well-being after spinal cord injury. And what that basically means is that we're trying to take a lot of the information that from data that we have obtained over the years from probably over 6,000, maybe over 7,000 people with spinal cord injury through various studies, and we're trying to take the information where we, as investigators, are challenged to get the information into formats that people can use. And it is a big challenge, but it's ultimately why we do the research, is that so somebody will pick it up in some form and use it to help them or someone else. Next slide. So just as an acknowledgement, we are funded by NIDILRR, and this is a grant on knowledge translation. We have also received a great deal of funding from NIDILRR over the years to fund our basic studies, which are in the areas of health, aging, quality of life, mortality, many areas of spinal cord injury. We also have done done research, not as significant in terms of volume, with MS and TBI, and we are certainly interested in all the research that we can do that cuts across populations and diagnoses, and where we can pick up from the model that we've developed with spinal cord injury as to how we approach the problems of people living in the community and how we can apply that to other diagnostic groups so that our work is reaching and addressing the needs of as many people as possible. So as a background, and I'm assuming most people are familiar with spinal cord injury, but it is traumatic injury that results in typically permanent sensory and motor loss. And that's really the group that we focus on, are those individuals who have a significant spinal cord injury and are living in the community or have gotten beyond the initial injury. Typically, our focus is not during the rehabilitation period, but the entire time frame afterwards, just what goes on with life. And people with spinal cord injury are at risk for a number of secondary health conditions, things like pressure ulcers, pain, depression, and it's not just people with the most severe injuries, but people who have a lot of functional recovery. They face their own series of problems. So there are a number of factors that lead to risk of development of secondary health conditions. So there are things like demographics and injury characteristics, and those are things we really can't do anything about. But there are also behavioral, psychological, and socio-environmental things people do, the environments they live in, their access to resources, which do affect their outcomes. And it's important to translate these findings from research, again, to promote utilization. So the need for knowledge translation. So why KT? Why is it important? People need easy access to information so they can utilize it. And this is for stakeholders and practitioners. And stakeholders is speaking broadly, people with lived experience with SCI, their family members, and even more broadly, the people that determine policies and allocation of resources. So in a clinical setting, a clinician, whether it's a PT, a nurse, a physician, they need to assess people very quickly for their level of risk. So, we can't develop lengthy assessment protocols that just simply won't be used in a clinic setting. If you go into a clinic, you usually fill out a brief history. And one of our goals ultimately is to link factors that can be part of that really brief assessment that you fill out. How often do you drink? What's a couple of key indicators of history, and such that ultimately clinicians can pick up on those very quickly and get some sense of risk for different things that might help them to work with an individual as to something like whether how independent of a transfer may be feasible. Policy makers also, they need to pragmatically know what factors affect outcomes because they need to allocate the resources to address those needs. And again, then people with spinal cord injury, we need the information about our own lifestyle behaviors and to get an idea of how that might affect our outcomes. So within the presentation, within our project overall, our goal is to translate new scientific knowledge relating to health and function to reduce the risk of secondary health conditions and other health complications after SCI. So we're trying to take the information that we put in a journal that goes out where people will read it and they may or may not change practice based on it, but it's just globally out there, and that we want to take that information and we want to develop knowledge translation methods, including automated individualized risk profiles and other creative ways of presenting information that can be used by consumers with SCI. Say people with lived experience, I like that reference much better, and interdisciplinary healthcare providers. So within our projects, having the involvement of people with lived experience and other professionals, it's really at the heart of the project. So we have engaged stakeholders, people with SCI, health professionals, and those who work with SCI registries in identifying which conditions to focus on, and we've done a number of things to do that. And so when I say people that work with registries, there are several state-based registries where all people with SCI are identified. Those are often used by public health officials, and so they are very close to policy, and we've been fortunate that some of our research we've been able to engage the professionals that access those registries in a couple of states, and so we've been able to do research on people that might otherwise fall through the cracks of the care system. So we convene stakeholder groups to identify the most important areas of focus. So what is it that people want to know about, what they want to prevent, what they want to know what their risk is. Our goal is to develop automated tools where someone can go online and put in a few key characteristics or behaviors, and that we can then give them, that they will get a prediction of risk, some tangible information that they can use, something where if they change a behavior or two, how that would affect their outcomes, or if something even as broad as employment status. And then we reconvene the stakeholder groups throughout the project and disseminate the tools through stakeholder, institutional, and public health agencies, and evaluate the utility within the settings themselves. So the process, we use standing and new collaborations to engage stakeholders. So, and again, professionals, people with SCI registries, we work through have engaged the statewide SCI Association, and again, this helps us to identify what are the prominent areas that people would like to see addressed, the tools, the usefulness of the materials that we develop, and any additional information that people with SCI or the other stakeholder groups might see as being helpful to be added, so that when people get the information on their risk, what is the context? What else needs to be added to make that useful? So we have held multiple stakeholder groups, and we've done this in South Carolina and Minnesota, where we have access to the registries and the SCI Association, and we presented findings of our research with health outcomes and asked about what is most relevant to maintaining individuals' health. And this is a work in progress. We are constantly looking to update and find different targets for the outcomes. So what are the things people really are most trying to prevent? What would give them the most tangible information? And so again, we're engaging a broad range of professionals, including those in public health. Everybody knows about rehabilitation, but once you're out in the community with a spinal cord injury, you may not have specialty care. It's one of the main things. So a lot of what is known within the various states, and what really drives what they do in terms of programs, is not so much based on rehabilitation as we think about it, that initial phase of time, but more things like attendant care programs, VR, things of those nature. So we're in the process of developing the automated tools and more traditional materials, and that's more things like fact sheets, and I'll talk about that in a minute. But again, we're trying to find usable formats for our stakeholders where they can pick up and use information. It's really a challenge. Right now, it's not a matter of there being no materials out there for people. It's being a matter of how do you get materials to them, and how do they sift through the materials that are there. So ultimately, by the time we're done with the project, we'll have developed at least 5 automated risk calculators, and 3 will be based on secondary health conditions one on a global index and one on a treatment index. So from a treatment index, we've focused in, we've narrowed down to hospitalization and emergency department visits. So we're evaluating the data as to which might be more informative. Global index, people, they want to know some projection of life expectancy. And so we are working to define what variables we feel are most important to that. And so the other three will be secondary health conditions, and pressure ulcers will be one of them. And so the part of the challenge is, we again have done a great deal of research, and so we're trying to boil it down to just a few factors. We certainly know which factors have been identified with research as to being most important. So the part of the selection process of what to do and which outcomes to focus on, it's not simply a matter of what we know in terms of can we identify things that appear to be related to those things that can be changed or the focus of intervention, but it's how to really get it down to the kernel of the ones that are most predictive, most important, and the things people will pick up and use. So we also are developing what I'm calling print materials, but not necessarily for printing, but more of a traditional report, non-individualized. So with an automated risk profile, it will be somebody puts in their age. They put in things like what they do. Are they, how often do they drink? Are they a smoker? Prescription medication use, things like that, and get an individualized, they would get individualized feedback, whereas with what I'm calling print media, maybe it would be better to say non-automated, where we cover findings and try to present information to people in ways they can pick up and use, but it's not going to be individualized. It may say something to the effect of, certain types of prescription medications are related to a risk of a certain outcome, but it won't calculate, there's no way to calculate for somebody. So newsletters obviously are a very historic way of doing this, fact sheets, but we've also have two additional types of materials that we're developing. A research brief is simply a one-page narrative from a publication. And so what we try to do for all our publications is develop a research brief, and it follows a model of what they've done with the KT centers and through the model systems, SCI model systems, but we have our own that we've developed, and it's just a way of keeping people informed of our research. But we're also doing research alerts, and research alerts is where there is a very specific outcome. For instance, a study we had just conducted that's consistent with the opioid epidemic. We looked at unintentional death due to drug poisoning, which is basically prescription overdose, people unintentionally overdosing on prescriptions. And we identified the risk factors for that being certain pattern of behaviors. And so we are putting that out as a research alert, something that gives somebody an alert. This is what we found very quickly. This is what we found. And these are the folks that are at risk. Are you at risk? And what can you do about it? So it has recommendations. So those are really something that don't come from every research study that we do, every finding, but only those that are most important. From the web, we want to use our website and social media, do webcasts and instructional videos once we've developed the calculators. We've had, it seems like we've been undergoing website modifications for literally a couple of years, and that's not within our team, but within our institution, and that process is nearly complete. And so literally within the next few weeks, we hope to be able to post new materials, but our hands have been tied with that a bit to date. So evaluation of materials. So, we do have, again, we have our groups look at the materials, and as we develop the calculators, we will have mock cases presented, mock cases of individual characteristics and how they affect the prediction. It'd be such that if you change a characteristic, you can see how it would affect the prediction, and the prediction being something like either does it increase or decrease life expectancy, does it increase, or how does it affect the likelihood of a hospitalization, those being examples. So we actively will seek the information or feedback from people who download the information and try to work with the social media outlets and in order to get feedback. So we have convened multiple stakeholder groups, people with SCI and health professions. The first target, again, will be life expectancy, and we're working on that. And so we're doing the analyses that will serve as the basis for the calculators. And again, we've developed a new type of alert. So moving forward, and this is the last slide that I will present. So moving forward and some of the challenges that we have, the calculator development is new to us. So we've invested a lot of efforts in how best to do it. We've looked at it a number of different ways, and we feel like we've come to where we're at the point now where we're down to one or two alternatives, and once we've done that, then developing them, I think, is going to be rather quick. Another thing is that the results of the study that serve as the basis for the calculators, they often require a different sort of data analytic technique. So some of the regression methods used, you think of regression, you think of prediction, statistical method. It basically is that when we look at what we need to do, how we analyze data for a paper for professionals, those methods that are best to analyze the data to identify what's important are not necessarily ways that convert directly into developing a calculator where a stakeholder can go in and quickly punch a few numbers in and then get feedback. And so ultimately that's our goal. We want it to be where a person with SCI can go in and they can get a quick assessment of how their situation, their characteristics, what they do potentially relates to, I wouldn't say the word affects, but relates to their outcomes, and the same for a clinician that would go in and might look at 4 or 5 items off of that big screen or that short screen, health screen, that information they fundamentally ask every time you go into an outpatient visit, and they can see a quick prediction of whether someone's in a low, moderate, or high risk group for a certain outcome, and that might affect their decisions. So that's the conceptual framework behind it. The translation of it is that requires somewhat of a different method. So another consideration, some of the variables are from scales that require multiple items to complete. So when we do our manuscripts and our analysis for publications, we're looking for anything that would relate to an outcome. We want to find as many factors as we can. So we're often looking at things like personality, and those things just don't lend themselves to calculators. So we're having to, again, reanalyze and break down into a more manageable group of variables so that somebody is motivated to go on and complete it, especially professionals. They're not going to want to take a lot of time, and we will have varying details for stakeholders. And so we're doing the work with a consultant to get the calculators up and running, and then we have, again, we've been developing the other KT tools as we have done this, and the other KT tools being what I called print or non-individualized, but things like the research alert and the research brief. So I do want to show you a picture of our research team. We're small, but we're mighty, and we have very fortunate to have a group of people that are really dedicated to doing the work, and this is a lot of We do a lot of data collection. We do a lot of publishing and presenting. And this is really our goal and vision to take it from those things that we've done all these years for professionals with SCI and more general dissemination and knowledge translation to really learn what we can to get materials out there where people can use them. So I thank you very much for your time today. I hope it's informative. And we will do an update with some of the actual tools in a future webcast. So thank you again for your time.
Well, thank you very much, Dr. Krause, and we look forward to that update. I'm especially excited to see some of those automated tools that you're developing, to see them in action. So before we close today, I wanted to invite all of our listeners to fill out this brief evaluation. This link is on the slide, but you can find it on our website as well at KTER.org. And if you registered, I'll go ahead and email you the evaluation link as well. You may also ask questions about this project by emailing me at aoutlaw@air.org, or you can ask your questions in the evaluation, and we'll be sure to get them to Dr. Krause and his team. So on this final note, I'd like to thank you all for listening to this presentation, and Dr. Krause, thank you very much for taking time out to speak to our project today and our listeners. And we appreciate the support of NIDILRR to carry out this webcast and all of our center's activities. So thank you, and have a nice day.